you so much to the Shelby County Health Department. We really appreciate everything you do for us and everything you do for our programs and your continued support of us over the years. Before we begin with our next presentation, just a few housekeeping things. Again, the CE links will be provided in the chat box. Make sure you click those. And our PayPal link will also be available in the chat box. So without further ado, our next presenter is Rachel Rice. Rachel Rice is the opioid and substance use epidemiologist at the Shelby County Health Department. Rachel analyzes data related to fatal and non-fatal opioid overdoses in Shelby County to help target interventions in the community. Prior to working with opioids, Rachel managed the team responsible for investigating clusters of COVID-19 in Shelby County. Since working with opioids, she has provided information to target advertisement campaigns for Tennessee Redline. She has also launched a survey to investigate recently overdosed patients and families of recently deceased overdose victims. Thank you, Rachel.
Can everyone see and hear me?
Yes.
Okay. Well, hello, my name is Rachel Rice. I am the opioid and substance use epidemiologist at Shelby County Health Department in the Bureau of Epidemiology, Preparedness, and Informatics. I've been with the health department since January of 2020, and I moved into my current role in November of 2020. And as stated, prior to becoming the opioid epidemiologist, I worked as a data analyst in the epidemiology department and on the COVID response. Today, we're going to go over a little background on Shelby County and the local opioid epidemic. For most of you, the history of the epidemic may not be new, but a refresher never hurts. I will then cover overdose death information, ER visit information, and then OD map, or suspected overdoses that have been reported by EMS. And in last year's summit, there was a review of the surge of cases in May of 2020. I'm going to do a brief overview and talk about a few points of residual impacts of that surge. Shelby County is located in the southwestmost corner of Tennessee and is bordered by Mississippi and Arkansas. The largest city in Shelby County is Memphis, Tennessee, which is the second largest city in Tennessee of all, which followed right behind Nashville. The population of Shelby County is just under 1 million with 937,847 residents. Shelby County is made up of 4 other cities besides Memphis, which takes up the largest area of the county, 2 towns, and 7 unincorporated communities. The largest population resides in Memphis. The population is majority Black or African American. The median household income is just under $50K. The unemployment rate is around 7%, and almost 19% of the population lives below the poverty level. Shelby County is unique because the populations and areas within it are very diverse. We have both rural and urban regions, and we also have a very low socioeconomic status or SES areas and very high SCS areas. This is a quick map that shows the population density of Shelby County. Density is highest in Memphis, all the red and orange areas. And as you move away from the city, the density thins quite a bit. Those areas are the more high SES and more suburban or rural areas, where the red regions within Memphis are all urban and more densely populated. This is just a brief review of signs and symptoms and what risk factors might lead to an opioid overdose. Some signs and symptoms can include loss of consciousness, unresponsiveness. They are awake but unable to talk, slowed, shallow, erratic, or stop breathing, choking or gurgling sounds, vomiting. The body can be limp, cold, clammy skin, blue, purplish black fingernails and lips, slow, erratic, or no pulse, and pinpoint pupils. And the main risk factors associated with an opioid overdose can include mixing opioids with other drugs, especially alcohol and benzodiazepines, such as Xanax, Valium, and Ativan. If a person has not been taking an opioid for an extended period of time and then begins taking it again, such as a person coming out of periods of sobriety in corrections facilities, detox programs, or rehab treatment facilities, and then also using these medications while alone. So how does opioid use disorder or addiction even form? Don't you have control over your own actions? Anyone who takes an opioid is at risk for addiction, and those with addiction in their families may have an even higher risk. Taking opioids for a long period of time can lead to tolerance. With increase in tolerance can develop into dependence, leading the person to become dependent on drugs to function normally, which then can lead to opioid addiction or opioid use disorder, also known as OUD, which is a chronic disease. It is important to understand that substance use disorder is a disease, not a moral failure. Now to get into some data about the opioid epidemic in Shelby County. This is death record data across a 10-year span showing all drug overdose deaths, opioid overdose deaths, and deaths due to heroin overdose. These numbers have been steadily increasing in Shelby County since 2011, 2012, and continue to get worse. From 2007 to 2017, more than 1,500 Shelby County residents have died from a drug overdose. In 2017, nearly 77% of drug overdose deaths in Shelby County involved opioids, and this percentage keeps increasing. The number of overdose deaths in Shelby County involving opioids increased more than 465% from 2007 to 2017. On average, 3 Shelby County residents died from an opioid overdose every week. To add, in 2017, more Shelby County residents died from opioid overdose than in car accidents. Vital record death certificate data was where we used to get most of our opioid data in the past. For a while, this was the most real-time data we had available, and this data comes to us on a lag. Since then, we have expanded our data streams to get much more real-time data, because data from 2017 isn't going to cut it from making decisions about what to do now, and we'll expand on this later. In 2017, Shelby County government chose to prioritize the response to the opioid epidemic, as data clearly showed the extent to which the epidemic was affecting the community. They allocated around $2 million to local funding to the Shelby County Health Department to develop a response plan and also spearhead all our efforts. This response plan was developed in 2018 and was comprised of 4 work groups: data use and integration, prevention and education, treatment and recovery, and first responder and law enforcement. In 2019, a 5th work group was added, harm reduction. All these work groups meet on a monthly basis, and prior to COVID-19, all work groups came together on a quarterly basis to form the opioid task force. In July, we had our first all work group since 2019. All work groups collaborate on projects together and support each other, as well as work on projects independently. Again, there's a lot of information on this page, but today we're mainly going to focus on what the work of the data use and integration work group. I am chair of this work group, and the major function of this group are to establish an integrated data surveillance system, create access to transparent and real-time data for professionals and the public at large, utilize state-of-the-art technologies to increase access to the opioid epidemic, and use data to drive change at the community, organizational, population, and policy levels, as well as to support all other work groups with data needs and with the most up-to-date data. Since the creation and implementation of the opioid task force in 2018, Shelby County had a total of 213 deaths. And in 2019, we saw a total of 342. Prior to 2021, data shows trends of suspected overdose-related deaths being less frequent in the summer months compared to the fall and winter months. Some explanations for the drastic increase in data could be many factors, one being the opioid epidemic is getting worse and we are seeing the surge in data. The second reason could be Shelby County is tracking overdose deaths more accurately using real-time data instead of waiting on vital record information. These are just some factors that maybe why we see a jump from 2018 to 2019. In mid-2018, we started receiving suspected overdose-related death data from the West Tennessee Regional Forensic Center. Through their death investigation and decedent information, or DD system, I'm able to watch for overdose-related deaths in a near real time as well as toxicology results and any additional information that may help determine if a death is due to illicit substance toxicity or not. This is a comparison of 2021 and 2020 deaths to this time last year. As you can see, we've already passed where we were at this time last year in total deaths. In July alone, the deaths had doubled compared to 2020. May 2020 did have more deaths than in 2021, but this falls under the May surge that occurred, which we will go over at the end of the presentation. April 2021 has been the worst month for suspected overdose-related deaths over the last 18 months. This increase in deaths could be due to the increase of fentanyl-laced narcotics and cannabis on the street. Average deaths per week have risen compared to last year. The least amount of deaths have tripled in a week compared to 2020. Our maximum amount of deaths has slightly risen, but not as much compared to previous years. And we are nearing the total amount of deaths we had at the end of 2020 when we have 3 months left in this year. Based off projections done in 2017 by Shelby County Health Department in conjunction with the University of Memphis, if nothing had changed in 2020, it was predicted to have a total of 288 overdose deaths, and in 2021, a total of 316. As you can see, we have exceeded those projections drastically, but things did change since 2017 with the pandemic. But while this is disheartening to see, we do have to keep in mind support services for people who were disrupted for over the last year and a half. MMWR means Morbidity and Mortality Weekly Report. The MMWR week is the week of the epidemiologic year, for which runs from Sunday to Saturday. For reporting and publishing purposes, cases are reported by MMWR as seen here. Overdose deaths during weeks 14 and 28 have been the largest increase compared to the previous year. MMWR week 14 was in April and week 28 was in July. Coincidentally, these timeframes in 2021 match when restrictions on COVID had begun to lessen due to vaccines being introduced to the entire adult population. I'm not saying that this increase in deaths is due to relate to the lifting of the COVID restrictions. However, it was interesting to see these timeframes overlapped. Ages 30 to 39 have maintained being the higher age group at risk for overdose-related deaths. The 40 to 49 age group is followed closely behind in rising deaths. Other age groups remain the same compared to previous years, and the 30 to 39 age group has remained the most affected across all of our data. Although 30 to 39 is the most affected age group, the Opioid Task Force is looking to create interventions that is targeted towards the youth or under 20 years old in order to educate, provide resources, and empower the youth to change current behaviors in order to prevent drug use later in life. Compared to 2020, Black males and Black females have an increase in suspected drug overdose-related deaths. However, there has been a decrease in white males and white females over last year. In 2021, the current mean of age death was 39.8, while the median age is 38 with a minimum age of 18 and a max of age of 79 for overdose-related deaths. As seen in the previous slide, the 30 to 39 age range and Black populations are the most affected by overdose-related deaths, with Black males in the 30 to 39 age group having the highest opioid-related deaths. Shelby County Health Department utilizes the electronic surveillance system for the early notification of community-based epidemics, also known as ESSENCE, to monitor hospital emergency departments for opioid or overdose-related ED visits. This helps us to see if there's an influx in the number of visits and allows us to compare the data to deaths that we were seeing. ESSENCE data began to be monitored about halfway through 2018 for overdose-related visits. The amount of emergency room visits that occurred in January 2020 were higher than compared to May of 2020. In January 2021, we had 190 ER visits, and in May of 2020, we had 186. Emergency department visits have remained an elevated number since April 2020 compared to ER visits that occurred in 2019. We do see beginnings of trends of elevated cases in ER cases in the winter months in 2019 and 2020, starting around October, and these taper off around February. This will be something to watch for this coming winter to see if it continues. Shelby County began on monitoring ODMAP in 2019. ODMAP is used to help monitor suspected overdoses reported by EMS for spikes in our community. If we see a certain amount of cases in a 24-hour, 7-day, 14-day, or 30-day period, Shelby County issues spike alerts to help notify our community partners of zip codes that are having a surge in opioid usage. This system was highly utilized in the 2020 May surge. Memphis Fire Department, or MFD, uploads majority of our suspected overdose cases into ODMAP. There are some cases from other emergency services in Shelby County. However, around 90% come from the Memphis Fire Department. In 2020, Memphis Fire Department decided to change the application programming interface, or API, they use to upload data in ODMAP. An API is a way in which emergency service can contribute data without an additional manual reporting into ODMAP. The API allows for data integration by connecting with agencies' record management software, or RMS, to ODMAP. This allows for an automated uploading of data to ODMAP. From late August 2020 to mid-November 2020, the area between the two dashed lines, few cases were uploaded to ODMAP as the previous API in use was down until the launch of the Memphis Fire Department's new API, allowing for automatic upload of cases. After launch, the cases from that time frame were added back into the system. And since the launch of the new API, we have not had the same amount of reporting levels prior to the change in APIs. Now, Memphis Fire Department only enters cases into ODMAP that have received naloxone due to being unconscious. Suspected overdose cases that were not administered naloxone but may have been conscious at the time EMS was with them may be missing from this data. But since the change in the API, the information upload has been consistent. In May in 2020, ODMAP observed an increase of overdose activity. Elevated cases were also seen in the ER and reported deaths. From April 27th through May 30th, 2020, 30 spike alerts were issued for a total of 482 cases that were reported in ODMAP. 431 cases were reported by Memphis Fire Department. Zip code 38109 was hit the hardest with a total of 28 non-fatal cases reported and 6 fatal cases reporting during this time. This surge occurred during the early stages of the pandemic, and many factors could have been at play with as the shutdown had set in. The first round of stimulus checks were also released in April of 2020. There was a breakdown in support structures for those in recovery due to the shutdown, and also events that could have been hosted safely by local community partners to help reduce opioid use were also shut down. This map represents cases reported to ODMAP from April 27th to May 30th, 2020. Each point on this map represents a suspected overdose, fatal and non-fatal. It also shows if naloxone was administered and if they received a single or multiple doses of naloxone. Fatal cases are represented by the diamonds and non-fatal cases are represented by circles. The different colors represent the dosage of naloxone administered to the suspected overdose case. The cases appear to cluster around the main highways and interstates. There were several main clusters, one being in the downtown and medical district area. A second cluster was observed in the highways leading up to the Hollywood area, and other areas heavily impacted were South Memphis and Orange Mound. Since May 2020, suspected overdose deaths and ER visits have maintained at an elevated level compared to previous years that have been monitored. The May surge has appeared to accelerate the amount of deaths we were receiving versus what was predicted in previous years based off 2017 data, previously discussed at the beginning of this presentation. Planned outreach events to help educate Shelby County residents about opioid addiction have also been delayed due to the ongoing pandemic. These events are slowly coming back, but the absence has had an impact on the lives affected by opioids. There has been an increase in offerings and reliance on virtual support groups for those in recovery or seeking help. This has its pros and cons as people are being provided the ability to get the help they need. However, not everyone may have reliable access to internet, or like many people, they could be suffering from fatigue of everything being virtual. And if you have any questions about county level data or would like to join the data use and integration work group, please call or email me. On the Shelby County Health Department website, I do post weekly updates on deaths, ER visits, and suspected overdoses reported by EMS. I post every Friday, typically by noon. I've also have posted the provisional reports up to Q1 of 2021 on our website. I've enjoyed having the opportunity to present to everyone here today. I know I finished a little early, but if you have any questions, I'll be happy to do my best to answer.
Hi, Rachel. Can you hear me?
Yes.
How are you doing today?
Good.
Good. Well, we want to thank you for coming out and, giving your time today and speaking about this really important issue. And some people just had a couple of questions that I just wanted to ask you real quick. The first question, somebody wants to know what factors are associated with the 30 to 39 age range being the highest for the overdose rates.
No, move this. That it's from what I've seen on my end. It would probably be just the usage seems to start younger, and that is when the deaths occur, is around the 30 to 39 age group, but that seems to be the one most affected. I would have to go back and look about the risk factors. Unfortunately, it's not in my notes right now.
Yeah, absolutely. Would you happen to know, I guess kind of some off the top of your head, some of the factors that affect more ER visits in the winter time?
Not at this time. It's just I started noticing the trend when I was reviewing for this presentation. Mm-hmm. And so I'm not ready to say it's a full trend yet. Mm-hmm. But I want to see how this year goes, since we've only been monitoring for 2 years right now, really full 2 years in the ER visits. And so now it could be, I'm not saying this is the reason, but it could be due, a lot of people get seasonal depression, the sun goes down, that is a factor. People are inside more like we were with COVID. So those could be some risk factors, but that would be something I'd have to go back and look at.
Okay, absolutely. We have another question. This one's a little bit long, so I'm gonna just go ahead and read it out. Somebody they're looking at the comparison data from 2020 to 2021, and they want to know, is it possible that in addition to hypothesizing that lifting COVID restrictions, that the influx of funds to stimulate the economy may also have an impact on drug use, substance use, and the increase in overdoses?
Like I said, there were many factors in that time frame. That could have been one. Stimulus checks were released, but also people were indoors more. People, like I said, did lose access to some services that were their support services and their support structures. So there could have been many factors, and that could have just been one of them.
Thank you for answering that. Somebody else wants to know, what are the interventions looking like kind of with the COVID pandemic, and how are the interventions looking, I guess, more virtually now? How is that affecting it?
Could you rephrase, please?
Yeah, so I guess just as we're in this pandemic and things are more virtual now, mm-hmm. How is that affecting interventions for people?
So it seems to be some things might have to be telemedicine based, but not everyone has access to reliable computers, and not everyone has they may have fatigue from using the computer so much for their work or whatnot in school. But But also it seems there could be reduced capacity to meetings, there could be reduced capacity to the other or the types of events that would be assisting them. So those interventions are they're coming back now that cases are getting better, but they're still in that reduction. I think as long as in terms of interventions and for helping with it, and I'm not the best person to speak on that, probably just following COVID precautions as we move forward. I think I got that question.
Yes, that was great. Oh, I just lost my question. Oh, here it is. Somebody wants to know, can you elaborate kind of on the factors on why overdoses are more prevalent in some areas of Shelby County more so than others?
One, education is one thing I know. Access to I think I'm not the best person to probably respond to this. I know we have someone else from Shelby County coming up later. She may be a better person to respond, but access and just education. I'm trying to thank you. But also just in the historical environment, I think does play a part of the area. So I know 38109 has been a big zip code. I've been asked a lot about data related to. So the historic, probably a social economic status in that area is also a factor into it and everything.
Perfect. Thank you so much, Rachel. We really appreciate you taking the time to come speak with us today and sharing all this really great information.
No, anytime.